everyone, I'm Christy and I write for Dr. Graves, and I've had acupuncture treatments off and on for the last 4 years for different things, and I've been able to reap the benefits of it, but I realized recently I don't really fully understand what it's doing, and that I just take for granted that it's working for me. So I'm going to ask Dr. Graves questions today of things that you might have questions about too, and are looking for the answers.
Great.
I'm ready.
All right. So normally when I've started to see people for a while and we've worked through some of their issues and we're kind of switching from an acute phase to maintenance phase, a lot of times I ask if people want to do a front treatment or a back treatment.
Yeah, you always ask me.
Yes.
You pick whether
So,
you lay on your front or your back,
right.
but why? What's
So
the difference?
the way I practice in traditional Chinese medicine, we're always doing kind of a full body treatment.
Okay.
So we can do that full body treatment whether people are laying face up or face down.
So just what's more comfortable?
What's more comfortable, more people. Then that's the full body treatment, and then usually we also are kind of doing specific treatments. So if people are coming in for digestive issues, ideally it's easier to access people on the front.
Okay.
If people are coming for back pain, or
Sure.
shoulder pain, so it's really kind of, I can do the general treatment face up or face down, and we can use points on the front or the back. But then where is kind of outside of your general treatment, where's the more specific issues, whether it's front-based issues or back-based issues.
Okay.
So that's kind of where we decide.
Well, today I want to just calm my mind.
Okay.
I'm teaching kids at home, so
Yep.
throughout some
So
of the
then
week, it's a little stressful. I need to calm down.
Yeah, so
I'm
usually
gonna
I
pick
ask-
my back.
Yep, usually I ask what people, if you've had enough treatments, most people, and they've had them both ways, most people know, like, hey, I relax better laying on my back, or I relax better laying face down. So.
Okay, so I'm gonna lay on my back.
Perfect. It should propped up here. And then,
Now, I know from things I've read that needles, acupuncture needles are balancing energy, but you don't really talk a lot about energy per se.
Yes.
Can you tell me what these needles are actually doing?
yeah, so the reason I do that is it took me 2 to 3 years of my master's program to even kind of get a concept of qi and meridians and energy.
And qi
Because
is what?
Qi in Chinese medicine is energy. So in Western medicine, blood flows through blood vessels. In Chinese medicine, they also have blood flows through blood vessels, but they add more of an energetic level that qi or energy flows through channels or meridians in the body. So the Eastern philosophy is that these meridians are like highways, interstates. With stress or trauma or bad diet or viruses or bacteria, it's like a car wreck on the interstate, and all that energy qi backs up. So what we're doing with the needles is we're selecting the acupuncture points on those channels or on those highways to help free up that traffic jam.
Okay.
We free up that traffic jam and we balance that energy, and then ideally the health symptoms and health issues resolve.
Okay.
And also what I think we haven't said in the last video is I do acupuncture a little different. When people are in here, they're always in control. So if something's uncomfortable, something's painful, you don't have to lay here and be miserable. You just got to communicate with me and we'll adjust it. It's okay to feel the needles. What most people feel, I say it's like a dull ache or a pinch. And usually you'll feel it for a few minutes and then it should fade.
Okay. Question here, what you just did in my ankle,
Yes.
it was much more sensitive
Yeah.
on the right side than
And the
it
left.
is the left, and with my hand. So is my highway backed up right there? Because
So
that's a little sensitive.
it can be, yeah. So certain points on certain bodies are more sensitive when there's stronger imbalance. Other times it doesn't always correlate, but more often than not, there's imbalance from side to side, and that's why we always treat both sides, because we want that energy flowing all through Yeah.
but it's slowly going away.
Yeah.
What does that mean? What is actually happening?
So, in Eastern or Western medicine?
I don't know either.
So in Eastern medicine, that ache is what we call, that's the chi sensation. That's me hitting the acupuncture point and opening that channel so we can, that unblocking the traffic jam, basically.
Interesting. Well,
Yeah.
for example, can you kind of tell me, like, what might be bothering me or why I have that symptom right there?
Why is that point more sensitive? Yeah, so it's the thing with Chinese medicine is it's very individualized, but this point here on the ankle is called spleen 6. It's kind of spleen 6 is a kind of connection of what's called your spleen, which isn't really the Western spleen, it's a Chinese spleen, your liver and your kidney. Now this is all energetic, it's not physical, so just because this is tender doesn't mean you have something wrong with your liver or your spleen. So it's more of an energetic, but in Chinese medicine, liver, kidney, spleen are what we call more yin or calming organs, and in this culture we're very young and stimulated, so a lot of times these points are more tender because all our energy's up here and not down here.
So it makes sense why I'm coming in for stress.
Yeah, because we want to get our mind and our energy out of here and more in our heart and our center.
Now I have one last question.
Yes.
When I first lay down, my mind goes crazy.
Yep.
And there's lots of chatter.
Yep.
But I find about 20 to 30 minutes into an appointment,
Yep.
I have a very unique sense of calm over my entire body, particularly my mind. What is happening?
Well, so that's the huge benefit to acupuncture. Not only are we treating your health issues and your conditions, you also feel better afterwards. You leave with a sense of calm. So when things are balanced and the needles help not only balance the channels and meridians, but calm down your overactive thoughts and get you in your body, and also put you in what's called parasympathetic rest and restore. So we're basically calming your nervous system, which kind of shuts that overactive brain off. So what we do is not only calm that nervous system, but we stimulate the body's healing, the parasympathetic, so then as you leave, the body continues to kind of heal itself.
I do feel it for days after,
Yeah.
and then when that stops, I actually feel like my body is craving it sometimes.
Yeah, because ultimately our bodies are craving balance. And in this culture, we're very out of balance. We live a high stress, high fast paced, over intellectualized kind of type of lifestyle, which is fine when you're 20, but as you age, you have to start to find that balance or the body is gonna make you find it.
Now I definitely feel when I go in,
Yeah. And so that's kind of the chi, and then after a few minutes, that should start to move. Yep. And you should be calm and relaxed, and then we usually let you lay here 10-20 minutes. We sometimes tweak the needles, pull them, and let you go. And then we follow once a week for 4 to 6 weeks. By 4 to 6 weeks, we should definitely see measurable improvement. So if you're coming in here for stress and we're treating stress and anxiety and you've got acupuncture nerves in a month, I want to say you can definitely say, yes, my stress and anxiety isn't cured, but it's 25 to 50% better.
Right.
If we're not making progress in 4 to 6 treatments, I'm impatient. Don't come every week for a year. We're adjusting things or changing things, so we're trying to move through things pretty fast.
Wonderful. Thank you so much.
You bet. Let us know if you have any questions and have a good day.